This presentation is made on behalf of Boehringer Ingelheim Pharmaceuticals, Inc. The company has provided financial support for this program. Presentation content has been reviewed for consistency with FDA guidelines.
Hello everyone, my name is Dr. Ayodeji Adegunsoye, and I'm a pulmonologist at the University of Chicago. Informing your patient about a diagnosis as complex as idiopathic pulmonary fibrosis can be very difficult. In this video, we'll be addressing some barriers for making a timely and appropriate diagnosis. We'll also learn firsthand from Kay, who's a patient who has been living with IPF for years, about what their journey with IPF is like. So Kay, can you kindly share with us who you are and tell us a bit about some of your symptoms and the lead up to your diagnosis?
Hello, my name is Kay. I'm 75 years old, I can say that, and I'm from Massachusetts. I was diagnosed with idiopathic pulmonary fibrosis, or IPF, in 2016. I can tell you the exact date too. I've been happily married to my husband for nearly over 50 years. Together we've had two wonderful sons. We have a beautiful daughter-in-law, and I have two wonderful grandchildren that I love. My family is my life, and they bring me joy daily. My first symptoms were what felt like, I want to say, an allergy. I went to my primary care because I had this cough. I had a drip. I was full. I always was believed it was some kind of an allergy, and I just was living with it. I was still working at the time, so I wasn't going to pay attention to it, but it just got nastier. So if you take a look at my medicine cabinet, I have now all medicine for allergies, for hay fever, postnasal drip, whatever, just to get rid of this cough. I took this cold medicine for a couple of years, but the cough never seemed to go away. And as the coughing got worse, it was like I just couldn't breathe sometime. It would just catch you in the throat. Once I noticed that I was having shortness of breath when I walked upstairs, I sort of was getting more concerned. But knowing me and knowing, where I worked and whatever, I looked for the closest elevator. Nothing was going to bother me. I wasn't going to take a day off to go find out what was wrong. And maybe that was my problem, not paying attention and not searching out another diagnosis. It was like, this is what I have, this is what I live with, and it's not going to bother me. And for a while there, it didn't. So as I worked and in my job, people started to notice. I didn't notice because I was working and that's what I had. They suggested, I know you went to your primary care. Why don't you try going to a specialist? Never knew what the specialist was, never paid attention to it until someone said, I think you need to go to a pulmonary specialist. So I didn't look online like any normal executive assistant does. I did the old-fashioned way. I looked in the Yellow Pages, and we have a medical center here in town, where I live. And, Yellow Pages, physicians, pulmonologists. go down, picked out one that was 5 miles, 5 minutes away. I called her on a Monday even, and got an appointment on a Wednesday. And that's how I met with my specialist, my pulmonologist. And it was the best thing I've done to date. So,
That is phenomenal. That is wonderful. I mean, it's not often that we get that rare gem of a patient who goes out of their way to seek the care from a pulmonary doctor by themselves. So I want to applaud you for that.
Thank you.
But when we talk about the diagnosis of IPF, how was it finally confirmed for you? What type of specialist saw you? What tests were involved in that process of getting a diagnosis for you? Can you share that piece of information?
The first test, and I keep telling people it's the funny test that they put the oxygen clip on your hand, on your finger, and you walk around the office for about 6 minutes. I still don't know the name of it, but that's the first test.
It sounds like the six-minute test you're talking about.
Okay, I'll go with that. I did high resolution CT scan. Let's see, what was the other one? Oh, full breathing test.
Yeah, that's interesting that you bring that up, Kay. So I will tell you, you're not alone. Many clinicians don't even fully understand what the disease idiopathic pulmonary fibrosis is. And so expectedly, patients may not really fully come to terms with that diagnosis themselves. But I was going to ask you, when you had diagnosis of IPF finally confirmed, what types of specialists were involved? What tests were performed for you to arrive at that diagnosis? Share that bit of information with us.
The final test before we got brought into the doctor's office, I had a lung biopsy. But once that procedure was done, he confirmed the suspicions of what the specialist had said. And he said all the tests, fall in line with what he saw in the lung biopsy. So when we finally did get back to the specialist and we walked into her office and we saw all the slides put up, she had them around the room, and she confirmed. She said that she would confirm that it was idiopathic pulmonary fibrosis. And I not only had it in one lung, I had it in both lungs.
You did bring up 2 points I wanted to dive into a little bit more. One is the requirement to get a biopsy, a lung biopsy, which you mentioned, to sort of ascertain that diagnosis of IPF. Yep. I wanted to find out how you felt about that, because I mean, they were going to take a piece of tissue from the lungs to make that diagnosis. And it's something we've been moving more and more away from in recent times, because once you've gotten that high resolution CAT scan, most people will say if it ties in with that diagnosis of IPF, there you go. You don't need to pursue the lung biopsy. But what were your thoughts about having to get a piece of tissue for most patients? I wanted to hear from you without even preempting you. What were your thoughts?
You have to understand, I just become a new Grammy. I just become a new Nana. I wanted all the tests done.
Right.
I really wanted a cure. I really wanted her to come back and say, there's a cure. Whatever she could do to get me through that point, we needed to do it, and we needed to do it fast. I really and truly didn't think, as I said, I never looked up lung biopsy.
I mean, most patients understandably want to get a diagnosis so they can begin treatment whenever it's available, or get a cure for the disease. it's completely understandable that we want to get the fastest way to get a diagnosis, and
Yes.
I can relate with that. But the other flip side to search for a diagnosis is what you brought up earlier on, the fact that the data from the CAT scan and the biopsy and the 6-minute walk test and all your medical information had to be taken to a conference to get discussed across experts, what we often would call the multidisciplinary conference today.
Yeah.
That is becoming more and more common in practice, and it really helps fine-tune the accuracy of the diagnosis that is made after getting all that information put together. Did you have any reservations about the data sharing amongst experts from your perspective when you were told
No.
about that?
No, I wanted it done sooner rather than later. You know, we had to wait for that last test to be done, that lung biopsy, before they would take all of the information and take the case. So I think that was the one thing that made me go ahead and have the lung biopsy.
Yeah, so it's reassuring that you had no reservations about your data being shared at the conference, because it really does help to make a really precise and a more accurate diagnosis, which, as you can imagine, is quite important for your care. But tell me, Kay, once you were diagnosed, what did your doctors tell you about your IPF? What information specifically did you find most helpful? I imagine you got quite a bit of information after that diagnosis was made.
Yeah. You know, I went in when we were meeting with my doctor I brought my husband with me. I just figured an extra set of ears, you know, listening to her. He'll ask the questions that I won't ask. Or I didn't get, and I didn't get past the words progressive, terminal, and no cure. It was mind-blowing. It has to be a better way of telling people that a disease has no cure, you know, and keeping their hope up, because at that precise day, I didn't hear anything. And that, if I could say anything to any doctor, was tell it to them better. You know, come up with a better way of saying there's no cure for your disease. Because sitting there, I couldn't fathom going on. You know.
Yeah, thank you so much, Kay, for sharing. Yeah, thank you for sharing that very frankly. I really appreciate it. I appreciate the transparency in your physician as well, in telling you the 3 cardinal features of that disease when it comes to the way it acts. The fact that it's progressive, the fact that it's fatal, the fact that there still is no cure for this disease. And thousands and thousands of clinicians the world over are still searching for a cure. And so I appreciate the fact that you had your spouse with you. What were your spouse's conceptions about what you had just heard from the doctor at that time?
We'll get through it as we get through everything. He listened to her.
As the doctor told you about IPF, what did you find most helpful? You mentioned the prognosis, the poor prognosis, but was there any particular information that stuck with you over the next several weeks to months from that discussion you had in the doctor's office that day?
The thing that stuck with me right then and there was knowing that I had somebody on my side, knowing that I had, you know, this doctor who, honest to God, I could call anytime. She was available to me anytime. I really and truly, I think at the beginning, I was, I wasn't in tune to what was going on. I didn't want to read anything. I didn't want to call an educator or whatever about this disease. So I had to get from an allergy diagnosis to a terminal diagnosis. And that's what I didn't get my head around. It took a while. I can tell anybody that wants to talk to me, it takes a while. And until you start reading, until you start learning about, what this disease does and the progression of the disease, you don't have a clue.
I wanted to sort of shine the spotlight on a different aspect. You mentioned the impact of the diagnosis when it was conveyed to you in the doctor's office. Is there anything else you wish you or your doctor had done differently in the time leading up to that diagnosis with IPF? Is there anything that you wish could have been done differently, either on your part or on the part of the clinicians?
See, I don't think so, because it was so new to us. It was, so new. I kept walking around saying, honest, what is IPF? I didn't know what it was until, yes, I went online. Yes, I went to Lungs in You. Yes, I went to different sites. There is no handbook that they say, okay, here, I'm giving you this, But at the time, I don't know if I would have read it. I've said this often to somebody, I did get a whole package of things, from the Lungs Association. I threw them away. I was in denial for a while, and it's like, no, this is not happening to me.
Yeah, you're absolutely right. There is no one size fits all recipe for how to handle chronic diseases, particularly those that are deemed fatal, and it still remains a challenge no matter what. Have you met other patients with IPF to share your experiences with at all over the last few years?
Well, I have, because I've been fortunate enough to be working like a patient mentor and visiting, around the country. I've been to Minneapolis, to Chicago, to Florida, twice, just to meet with other patients, and other doctors as well, and their thoughts on how they're progressing and how they're doing, and to tell them, there's no end in sight, but it's what you make of your life living with IPF.
Yeah,
Yeah.
I'm sure your cheerful demeanor and your uplifting spirits must have done a lot to encourage other patients as well, as you shared your experiences with them. But as you did that, did you get a sense that other patients had similar symptoms or different symptoms to what you had experienced? Did you have the same milestones on your respective journeys with IPF with other patients?
Other patients seem to have different, I'm not going to say problems, but different roadblocks. So I can talk to them about what I do, how I live with IPF.
Right.
Yeah.
Yeah. So yeah, you're right. Patients often have different experiences with the disease, and it seems like for you, the most prevalent or the most prevailing symptom was this bothersome cough. But many other
Yeah.
patients have complained about shortness of breath, inability
Yep.
to exercise like they want, and a variety of other symptoms. What advice would you give a new patient who's newly diagnosed with IPF today, for example? What would you tell them?
There's no handbook on how to react to somebody telling you you have a terminal disease. But they need to say positive.
I was going to segue very briefly to a different aspect as well. Can you tell me a bit more about your healthcare team and how they collaborate to help the disease of the IPF that you've got? Does that team include a pulmonologist, a lung doctor? Does it include a nurse practitioner? Have you got a GI doctor, a gastroenterologist helping, or a respiratory therapist, for example? And how do these different people coordinate to help advance your care?
Honest to God, none of them. I only have a pulmonologist, and she's out of a medical center. I haven't gone to respiration therapy. I can tell you truthfully, the first thing that, and I'll tell it to anybody, my thing that I am most afraid of is going on oxygen. I will do anything. I will exercise. I will breathe. I will walk 45 minutes a day just so I don't go on oxygen. And yeah, that's my fear. So in keeping in that, it's working with the pulmonologist. I see her every 3 months. I do my blood work. I have my breathing test every 6 months. And that's it. You know, that's it.
I really love your attention to detail in your healthcare and paying attention to the things that matter. You nicely illustrated that there is a lot of variation in how people experience the disease IPF. Some people have just a primary care provider, others have a pulmonologist, and for others who are way more advanced in their disease course, they may also get involved with the care from a respiratory therapist as well to help them with their oxygen needs and all that.
Yep.
So like you rightly said, it's very variable along the line. Can you tell me from your perspective what the everyday impact IPF has had on you? What training or education did you receive to help deal with these challenges that you experience on a day-to-day basis? And how do you navigate your day with the disease IPF?
I think I'm one of the lucky ones, doctor. I wake up in the morning grateful that I'm getting up and out. I don't have the constriction in my chest or in my lungs that other people tell me they have. Every day to me is a blessing. I can say that to you truthfully. I don't suffer. I suffer from a cough, as I say it. I don't have the other side effects or the other things that people tell me they're suffering with.
But you mentioned earlier on you've been bothered by the cough that comes very often during the course of the day. Do you feel prepared when it comes? Do you have a sense of control over the cough? And how do you confront the challenges that come with the cough that you experience with IPF?
It takes you by surprise. It takes you by surprise, as you probably know from your patients. You can be having just a conversation with your next door neighbor, because now that I'm retired, that's what we have next door. But it takes you by surprise, and you have to stop, and you just have to gather your air, because it does grab you. It's this nagging cough, and it does come all of a sudden.
I had one more question for you, though. Actually, it's more like a composite question, two in one. If you could say one thing to healthcare providers who deal with IPF on a daily basis, as a patient, what one thing would you say to healthcare providers? And the second question to that is, if you could give one word of counsel to fellow patients with IPF, what's the one thing you would love to tell them? So we'll start with the second question first, if you may.
Anyone who knows me, or if they don't, but anyone living with this condition, you need to be, I find now, and this is after 5 years, you need to be open about it. And you have to be positive. You have to be positive to know that you are going to get through it. as for healthcare workers and healthcare people, just stay positive with us. Yes, in time, yes, we will find a cure with research, but stay positive with us. I know I have the best one yet, and she's there with me, at every step of the way.
Well, thank you so much, Kay, for sharing your perspectives and your experiences with us today. I believe you are the perfect embodiment of staying positive, both for patients and for clinicians alike. I'd like to thank everyone also for joining us today and for watching this video. To learn more, please visit insightsinILD.com. Thank you.